Welcome. On behalf of Therapy Ed, it is my pleasure to present this session on frequently asked questions about the NBCOT exam and effective exam preparation for OTA exam candidates. I am Rita Fleming-Casaldi, Therapy Ed's Director of OT Education, editor of Therapy Ed Certification Exam Review and Study Guide, and a Therapy Ed course instructor. In addition to my Therapy Ed roles, I am Professor Emeritus at the University of Scranton and the chairperson of the Occupational Therapy Leaders and Legacy Society History Preservation Project. Before we begin, I need to note that Therapy Ed is not affiliated with the National Board for Certification in Occupational Therapy. NBCOT, OTR, and COTA are registered trademarks owned by the NBCOT. During this session, I will answer the questions students and exam candidates frequently ask about the NBCOT exam by providing accurate and current information on the COTA certification exam format and content, the administration scoring of the COTA certification exam, the need to obtain and use test-taking ADA accommodations if eligible, the importance of being a critical consumer of exam preparation products to ensure they are current, accurate, relevant, and effective. I will also highlight during the session resources that can help you structure an efficient review of your professional education to ensure mastery of the knowledge required for NBCOT exam success, and also resources that can help you develop effective test-taking strategies and skills to successfully pass the NBCOT COTA exam. As we'll see throughout this presentation, I will be using multiple screenshots from Therapy Ed's National OTA Certification Exam Review and Study Guide. As a result, I ask that you comply with copyright law and occupational therapy's code of ethics, and do not record or take pictures of any parts of this presentation or publicly share any aspects of it. I will provide page numbers from the OTA Review and Study Guide on which the information I present can be found. I thank you for your compliance with these guidelines and our profession's ethical standards. So a frequently asked question is, what is the format of the COTA exam? The NBC COTA exam is comprised of 190 multiple choice items that include traditional 3 and 4 option single response items and 6 option multi-select items. There is no separate section for 6 option multi-select items. The 6 option multi-select items are distributed out the exam in between the traditional ones, and there is no predetermined exam percentage for the traditional 3 and 4 option items multiple choice or the 6 option multi-select multiple choice items. For the 3 or 4 option single response multiple choice exam items, you must choose one option that is most correct. For the 6 option multi-select items, you must choose 3 correct options. There are no answers in the 3 or 4 option single response or the 6 option multi-select items that are provided in a combination format. For example, A and C, all the above or none of the above. This is an exam hint, which is the format that we use to highlight important information so that it really stands out in the text. And as I have stated, I will be given the page numbers where the information can be found. Okay, another question is, how is the exam scored? Credit is awarded for the selection of every correct response, including 1 out of 3 or 2 out of 3 for the 6 option multi-select items. You earn credit for every item that is correct. There is no penalty on the certification exam for incorrect answers, so do not leave anything blank. Each exam contains items that are not scored because the NBCOT is field testing them for future exams. They are interspersed throughout the exam. And as per this exam hint, there are no identifying characteristics to distinguish unscored field test items from the scored operational items. Therefore, you must answer each item as if it counts. The NBCOT exam uses statistical procedures to convert test results into scale scores that range from 300 to 600, with 450 as the passing score. So what do you need to know to pass the NBCOT exam? Every 5 years, the NBCOT surveys practicing COTAs to determine the core tasks that comprise entry-level practice and the knowledge required to perform these tasks. The outcomes of the practice analysis are used to construct exam content, creative specifications, and guide exam item writing. Thus, the content of the current exam implemented in 2024 will not change until after new practice analysis is completed and analyzed in 5 years. The NBCOT considers entry-level practitioners to be those who have been certified for 36 months or less. The exam tests generalist knowledge required for entry-level practice, not advanced or specialized knowledge, for example, the NICU or anything that requires additional certification. I also want to briefly go back and just state on this slide that this is the same scoring that has been done since 2019, and this is the same format that has been done since 2019. So the format and the scoring of the exam have remained the same since what was in effect in 2019. And the only thing that's changed is that we have a new practice analysis. However, the practice analysis, the content outline that was based on that practice analysis that was published in 2022 and provides the foundation for the construction of the exam items is comprised of 3 domains, same as the 2019 exam. So domain 1 is collaborate and gather information, domain 2, select and implement interventions, and domain 3, uphold professional standards. Under each of these, specific task and knowledge statements are provided. Domain 1 is 3 tasks with 9 knowledge statements. Domain 2 is 3 tasks with 12 knowledge statements. And domain 3 has 6 tasks with 29 knowledge statements. It is worth noting that the content of 2024 exam is very similar to the prior exam. The focus of each domain remains the same, with slight wording changes in some points, and the percentage to 2 domains has changed by only 1 point. Domain 1 was previously 28% of the exam, and it's now 27%. Domain 3 was previously 17% and is now 18%. The complete code exam content is available at NBCOT.org. I'm now going to share some specifics about what you need to know for each exam domain. Due to time constraints and the availability of the complete content outline on NBCOT's website, I'll be only highlighting a few knowledge statements per domain. I selected ones that over the years I've seen raise test takers' anxieties or new ones for the 2024 exam. To prevent undue angst, because a picture's worth 1,000 words, I provide examples of how this content is covered and readily accessible in the 5th edition of TheraPED's Review and Study Guide for the OTA exam. I want to also share you at the outset of this presentation to review and study all the content that may be tested on the NBCOT exam. You will not need to rebuy the course text you sold or return, nor do you need to download and print hundreds of pages of PDFs. As you will see in the screenshots and the table of contents for each chapter, as per chapter 5 here, and of the other chapters I will be showing screenshots, TheraPED's Review and Study Guide covers all the content you need to know in a very clear and organized format. We will talk about how you can effectively use this resource in a few minutes. So a key task under Domain 1 is recognizing the influence of development and lived experience, body functions and body structures, values, beliefs, and spirituality, and identity on occupational performance. Now, while this domain covers many factors, this domain task covers many factors, its knowledge statements provide increased specificity about what you must know to be able to competently perform this task, such as impact of development and aging on occupational performance, health, and wellness across the lifespan. As you can see from Chapter 5's list of table of contents, reviewing and studying the information provided in this chapter will provide you with the foundational knowledge you need to apply to correctly answer exam items that test your knowledge about development and aging. In addition to providing exam hints, as per the ones I just showed in prior slides, we also provide caution boxes throughout the review and study guide to call your attention to important information that you should know to help ensure your exam success. This caution box about the CDC developmental surveillance guidelines is particularly important since some providers of exam prep information have falsely stated that studying the CDC guidelines are sufficient for exam success. As outlined in Table 5.1, the CDC guidelines do not replace skilled OT screening and evaluation. Because there is so much to know about development, we have always included important information in Chapter 5 in boxes, figures, and tables, and also throughout the entire text to help exam candidates prioritize what is most important to study and to support visual learners. So here's the example of developmental levels of grasp from the ear-heart prehension assessment and developmental sequence of toileting. We have multiple pictures, reflexes, other types of grasp in the Chapter 5, and also tables for developmental sequencing for IADL, play, etc. Dressing. This exam hint emphasizes another Domain 1 task, which is the impact of body functions and body structures on occupational performance. Comprehensive and current information about the conditions that limit occupational performance is provided in Therapy's OTA Review and Study Guide in chapters 6 to 10. A quick scan of the table of contents of chapters 6 to 10 demonstrate that the Review and Study Guide contains content you need to know to answer NBCOT exam items about major body structures and functions. So chapter 6 covers musculoskeletal system, chapter 7 neurological system, chapter 8 cardiovascular and pulmonary system, chapter 9 gastrointestinal and other body systems, and for other information about how function is affected by diagnoses, chapter 10 covers psychiatric and cognitive diagnoses. Task 2 for domain 1 is also very broad, but again, its knowledge statements can help you hone in on what you need to know, such as medication side effects and interactions. Key information about medications, their functional impact, such as the development of metabolic syndrome with second-generation antipsychotics, is provided in chapter 6 to 10 where relevant. As per this task and knowledge statement, all you have learned about the value of an occupational profile and client-centered evaluation is also tested on the NBCOT exam, and the Review and Study Guide provides this information in clear and organized format. For example, box 3.1 provides questions for obtaining an occupational profile. In addition to these questions here, the box is extended and goes further down the page, and it includes additional questions to obtain a person's occupational history and understand their personal and environmental factors that may hinder engagement in desired occupations and performance of life activities. Similarly, foundational knowledge about group processes, dynamics, types, and functions is tested on the NBCOT exam. Table 3.1 outlines the purposes, assumptions, and member criteria for 5 major types of activity groups, including evaluation groups, thematic, topical, task-oriented, instrumental, and developmental groups. Because the coverage of therapeutic groups varies widely in OTA programs, the Review and Study Guides provide substantial information, including several boxes and tables. As noted here, stages of group development, curative factors, group membership information, criteria for group leadership styles, and then activity group leadership roles and suitable activities, developmental group leadership roles and activities, and the purposes and foci of developmental groups. As you can see by a list of the table of contents, in addition to extensive information about therapeutic groups, Chapter 3 includes key information about the foundations of OT practice, including all stages of the OT process, clinical and professional reasoning, therapeutic use of self, activity task analysis and synthesis, education and training, and standard and transmission-based precautions. All content that we know is tested on the NBCOT COTA exam. This slide highlights another area of domain of concern for domain 2, and this is task 1 also. And this is content knowledge that is needed for exam success. And this shows how the hint again relates directly to the exam content outline and how you need to know knowledge about selecting, preparing, and adapting the intervention technique to support optimal engagement and promote goal achievement. An example is theoretical approach and frame of reference. A quick scan of table content chapter 13 demonstrates that the Review and Study Guides contains all the content you need to know to answer NBCOT exam items about psychosocial theoretical approaches and frames of reference, including occupation models such as MOHO and PEO, cognitive disability frame of reference, sensory processing model, and interdisciplinary mental health practice models such as CBT, developmental, CBT, recovery, and psychiatric rehabilitation. Chapter 5, as you saw in the cover page for that, it includes extensive information about lifespan and developmental theories. And as you will see when I show you the contents of chapters 11 and 12, biomechanical, neurological, sensory processing, and cognitive perceptual theoretical approaches are also well covered in the Review and Study Guide. And this chapter also covers all the information you need to know about evaluation and intervention in psychosocial practice. Additional knowledge that is required to correctly answer Domain 2, Task 1 exam items includes the indications, contraindications, precautions, and clinical application of superficial thermal agents. Also, the indications, contraindications, and clinical application of the thermal, mechanical, electrotherapeutic, and physical agent modalities. The importance of knowing contraindications are emphasized in Chapter 11 in red flag boxes, and precautions are provided in orange caution boxes. Task 4 in Domain 2 addresses the COTA's ability to select, fabricate, and modify orthotic devices and provide training in the use of orthotic and prosthetic devices in order to support functional outcomes. And it requires knowledge of the types and functions of orthosis for managing specific conditions and congenital abnormalities. And also it has that you need to know how to select, design, fabricate, and modify. Both chapters 11 and 12 in the 5th edition of the Review and Study Guide provides comprehensive information about this area of concern. And there are several photos of orthoses that are provided to supplement the chapter narrative content. Besides covering orthotic devices, chapters 11 and 12 cover all aspects of biomechanical, neurological, and cognitive perceptual evaluation and intervention, including theoretical frameworks, and in biomechanical, range of motion, muscle strength, endurance, prosthetics, burns. There's a great amount of information covered in chapter 11 and 12. As noted in this exam hint, Domain 2 requires knowledge of adaptive and preventive strategies for supporting optimal engagement in occupation. Chapter 14 in the Review and Study Guide provides clear and relevant information about adaptive equipment and adaptive strategies that enable performance in all areas of occupation, as illustrated in Table 14.3. We also have tables about adaptive equipment for play and leisure, and adaptive equipment for IADLs, and also information about accommodations at work. Because test takers' knowledge of the functional abilities of a person with spinal cord injury varies greatly, we provide tables that describe the ADL, instrumental activities of daily living, play and leisure abilities of a person with spinal cord injuries from level C1 to C3 through levels T1 to C5. As this exam hint notes, principles of ergonomics and universal design for identifying reasonable, for recommending and implementing features and reasonable accommodations workplace, are required for competent and safe OTA practice. Table 1411 in chapter 14 covers reasonable accommodations to enable effective work performance according to personal self-efficacy, duration of concentration, screening out environmental stimuli, maintaining stamina, multitasking, responding to negative feedback, and symptoms secondary to prescribed medication. And under each of these main titles, there are key concrete points of reasonable accommodations. Chapter 15 includes extensive information about universal design, accessibility standards, and reasonable accommodation for the environment that enable participation. This is in Table 15.1. All 7 principles of universal design are described as per this example here with equitable use, and a practice example is provided for each principle. As you can see from the title page of Chapter 14, Review and Study Guide provides extensive information about the evaluation of occupation and the interventions COTAs can use to enable occupational engagement and performance for all areas of occupation, including rest and sleep. Chapter 15 provides comprehensive coverage of all your environmental evaluation, home evaluation, low vision, fall prevention and management, all your accessibility standards and the corresponding environmental modifications to enable access, functional mobility, mobility aids, wheelchairs, seating system, assistive technology, community mobility, driver rehab and driver cessation, and environmental interventions for cognitive disorders and restraint reduction. All information we know is tested on the NBCOT exam because it's in the content outline. The first task of Domain 3 of the COTA exam is employ evidence-based strategies and approaches to provide safe, effective, and efficient services relevant to individuals, groups, and populations. And specific to that is aging in place and fall prevention. That is the type of knowledge you need to know about that type of programming. Chapter 15 covers both of these topics quite well. Box 15.1 includes information about intrinsic fall risk factors in the home, so you know what to evaluate and what to prevent. 15.2 includes strategies and modifications to prevent falls, And 15.3, box 15.3, outlines strategies to reduce falls, risk factors, and clinical situations. Domain 3, Task 1 knowledge statement, another knowledge statement related to that task, is methods for locating, reviewing, and interpreting scholarly research to guide practice relevant decision making. Some examples include the PICO. Information about methods for locating, reviewing, interpreting scholarly research to guide practice relevant decision making, and the PICO model is included in Chapter 4. Box 421 includes all steps in the CAP process, and Table 47 outlines the steps in evidence-based practice. Again, tables and boxes are used in the text to emphasize essential content knowledge. Domain 3, Task 2, incorporate risk management techniques at the individual and practice level to protect clients, staff, self, and others from injury or harm, includes knowledge about strategy and resources for professional burnout. This is a new knowledge requirement. Chapter 4 provides solid information about professional development and the prevention of burnout. A screenshot here is the section about the individual actions and strategies, but it also includes burnout prevention actions and strategies for supervisors and administrators. Task 3 is another broad statement for which the knowledge statements are very helpful in determining what test takers need to know. For example, the influence of reimbursement policies and guidelines on occupational therapy services. Chapter 4 includes extensive information about reimbursement, with boxes outlining Medicare reimbursement criteria. And this is important because Medicare is a federal program, and it is the major national payer for OT services. So your knowledge of Medicare coverage will likely be tested on the NBCOT exam. So we have boxes about the criteria for durable medical equipment coverage, Medicare reimbursement criteria for Part A, Part B, and homebound status. As per Chapter 4's table of contents, this chapter provides comprehensive information about the content knowledge that will be needed to apply to answer Domain 3 items, everything from ethics to federal legislation to risk management, all your service delivery models, and all your payment information, supervisory information. So, what do you need to know past NBCOT? It's a lot. The NBCOT exam tests the depth and breadth of COTA practice, so the amount of knowledge tested is a lot. However, if you are preparing to take the NBCOT exam, you have earned the status of being an exam candidate. You are no longer a student. Congratulations. That's a big achievement. To accomplish this, you had to pass challenging coursework and fieldwork, so you clearly know a lot and have skills you can apply to NBCOT exam preparation. Will you likely want guidance to do this effectively and efficiently? Of course. Fortunately, TherapyEd has over 27 years of experience in doing this. Since 1997, TherapyEd has been a leader in preparing graduates of OT programs for NBCOT exam success. Our resources include the Certification Exam Review and Study Guide, which you've seen many screenshots from, and all the table of contents from the chapters 3 through 15. But that includes 3 online practice exams and an AI learning assistance, which I'll talk about in a minute. We also have online on-site exam preparation courses, which I'll also speak more about, mobile test prep app, individual tutoring, and free online office hours and content review sessions, exam in a week of social media, and recorded content review sessions. Before I go and discuss a little bit more about some of these resources and how they can help you succeed on the NBCOT exam, I want to answer a very important question. I have a disability, but I did not use the accommodation to take tests during my program. Should I apply for NBCOT testing accommodation? The answer is yes. I understand that the decision to request or not request testing accommodations for the NBCOT exam is a very personal decision, and it is often influenced by students' personal experience with testing accommodations during their OT education, including not using them. However, it is very important to recognize this experience may not be generalizable to the NBCOT exam. The content, format, and test-taking experience of the NBCOT exam differs very significantly from course-specific exams. Therefore, we strongly urge all eligible candidates to apply for any and all accommodations for which they are eligible. Table 1-2 in the OTA Reviewed Study Guide outlines the NBCOT exam activity demands and the environmental context as compared to course exams that you take in your program. You should carefully consider these to inform your decision to request accommodations or not. These are all extremely important points to consider, and I strongly recommend you take accommodations. Regardless of whether you use testing accommodations or not, you need to enter the NBCOT exam with solid content knowledge. As demonstrated in the screenshots that I did content to the NBCOT exam, the Review and Study Guide is a primary resource for mastering this content. In addition to providing the content you need to know to pass the exam in chapters 3 to 15, Chapter 1 in the Review and Study Guide provides current and accurate information about the NBCOT's COTA certification exam content, format, and procedures, and test-taking management strategies help you successfully answer all exam items within the allotted time. And Chapter 2 describes how to develop and maintain a positive psychological outlook about exam preparation and test taking. It provides clear guidelines for structuring and implementing an individualized and manageable exam preparation plan, and explains how you can apply your clinical and critical reasoning to the NBCOT exam. At the ends of chapters 3 to 15 in the OTA Review and Study Guide, open-ended content-specific review questions are provided to help you jumpstart the thought processes you will need to apply to effectively answer exam items. Answers to these questions are provided in the book's appendix. These questions are meant to help you think about the knowledge you should have acquired from the chapter, thus they are not in an objective format. Answering them can help you transition from thinking like a practitioner on fieldwork to thinking like a certification test taker, which is the by-the-book answer. They are also an excellent resource for study groups. There are two examples here. The first one is from Chapter 12, and the second one is from Chapter 13. Another thing that increases the efficacy of using Review and Study Guide to prepare for the exam is that you get 3 complete online practice exams with the Review and Study Guide. You don't have to purchase them separately. They are purposely designed to mirror the NBCOT exam. Each practice exam has 190 items that include the traditional 3 and 4 option items and the 6 option multi-select items. Immediately after you complete an online practice exam, TherapyEd's Learning Portal will display a score report about your exam performance. This includes the amount of time you took to complete the exam item answered correctly and incorrectly, the percentage of items you answered correctly according to the 3 NBCOT exam domains, 5 critical reasoning skills, and 9 content knowledge categories. And the critical reasoning content knowledge categories are unique to TherapyEd's practice exams. When you receive this detailed score report, you can click on each exam item to be immediately linked to a detailed explanation about the content and critical reasoning rationales. Each exam item rationale page includes access to an A-line learning assistant that provides answers to frequently asked questions about the item's focus and its rationale, with an option to ask more questions to obtain in-depth and customized information. And here is an example of a screenshot of the learning assistant. Access to TherapyEd's online learning portal, which contains your exam scores, all 570 exam items with their answers and rationales, and the AI learning assistant is available for a full year. Guidelines for using the score report data to revise your exam preparation plan are provided in Chapter 2. These guidelines are unique to TherapyEd. Unlike other practice exam score reports, TherapyEd actually includes clear, concrete guidance on how you can use the provided information to inform and guide your exam preparation. So box 2.1 explains how you can use domain score report and how you can address the concerns about scores in that area. Critical reasoning is in box 2.3, and there's quite a bit of information in the chapter on how to improve your critical reasoning skills. And then the content category score report. Again, we provide specific guidelines on how you can use that information to inform and guide your exam preparation plan. And this table 2.5, shows you if you have concerns about any of these content categories, it tells you the chapters that you should be studying to improve your performance in those content categories. Now, important thing to know, there are 2 aspects to NBCOT exam success. One is mastering the content via a targeted study plan, but the other is also knowing how to effectively determine correct answers to exam items. Therapy's comprehensive and interactive exam preparation course addresses both of these aspects. Each course provides essential information about the current NBCOT exam to ensure full understanding what is required to pass. They emphasize active learning to develop the clinical and critical reasoning skills needed for successful test taking. And they teach you strategies for breaking down and analyzing exam items to determine correct answers for both the single response and six option multi-select exam items. Courses are offered on campus and online, are taught by highly qualified OT and OTA instructors. The course fee includes a review and study guide with those 3 online practice exams and 12 months access to the portal with the score reports and the AI learning assistance and all the rationales. It also includes a course manual, and that manual is a guide through the review and study guide. And it also includes study hints and numerous self-assessment and exam preparation forms. If you purchase the 5th edition of the review and study guide from Therapy prior to registering for a course, your purchase price is credited to the course fee. And Therapy does allow free retakes of their course, and there are group discounts. In addition to EOT certification exam review and study guide, the 3 online practice exams, the AI learning assistant, and our online on-site exam preparation courses, Therapy also provides a mobile test prep app, personalized individualized group tutoring, free online office hours and content review sessions, exam line a week on social media, and recorded content review sessions and webinars on Therapy's YouTube channel. To access these resources, you just need to go to Therapy's webpage and click on OTA, and it will bring you to this page that has a number of sections that you can click on in the toolbar. This is an overview of the topics that are covered during Therapy's free online office hours and content review sessions every Tuesday between 7 and 8 p.m. Eastern Standard Time. There are many certification exam preparation products on the market. You could spend a lot of money purchasing multiple products with varying quality and utility. Therefore, I want to highlight the bottom line about the Therapy difference. Therapy is the only OTA certification exam prep provider that offers all-inclusive, comprehensive, well-vetted, and highly regarded products and resources that enable you to effectively, efficiently, and economically prepare for the NBCOT exam. Again, the review and study guide includes in one product all the information you need to know about the exam, all the content that is directly linked to the NBCOT exam content outline, the content-specific review questions help you jumpstart your studying, 3 complete exams, which model the NBCOT exam format and content, and that 12-month access again to the practice exam score reports with those in-depth rationales and the AI learning assistance to obtain more information about the item foci and gives you an option to ask more questions. The exam preparation course that is presented in person online includes in its price the review and study guide and access to all of the above features that are with the review and study guide. It also is a highly interactive experience that emphasizes active learning to develop the reasoning, test taking, and time management skills needed to pass the NBCOT exam. It provides essential information about the current exam to ensure students, exam candidates, full understanding what is required to pass it, and includes a course manual that provides a roadmap to the review and study guide and numerous assessment and study plan forms for developing an individualized exam preparation plan that focuses on building your strengths and addressing your limitations. Supplemental resources include, again, tutoring, mobile app, and free online office hours, content review sessions, free exam item a week, and free YouTube access to exam prep webinar. Regardless of which exam preparation product you select, prior to deciding which product you will use, you should ask the following questions. Does the product include current and accurate information about the COTA certification exam format, content, and procedures? Is it comprehensive, organized, and well-integrated content that is directly related to the exam content outline? Are there effective test taking and time management strategies to help you correctly answer items and complete the exam in a lot of time? Are the practice exams that accurately reflect the different types of exam items you will be required to answer on your exam? And do they have real-time experiential learning opportunities and individualized live support? Another important question is, are product providers experienced and well-regarded educators with established reputation for excellence, integrity, and service to the profession? The Therapy team is proud that the quality of our products and resources and the expertise of our course instructors and text contributors will enable you to affirmatively answer yes to each of the above questions. On behalf of the Therapy team of educators, I want to thank you for taking time to view this webinar. We look forward to working with you to effectively prepare for and succeed on the NBCOT COTA certification exam and wish you a most rewarding career as an occupational therapy assistant. More information about Therapy's exam prep resources, please see therapyed.com. These are my references, and if you would like a copy of the reference list, please contact me at Rita Fleming Casaldi at scranton.edu. Thank you.